Okay, so I had to start a new video because I hit the wrong button, but you know, that's the way it goes. Alright, so now we're going to continue with skill 6.16, which is performing catheter care and removal. Right now we're on the emptying a collection bag, okay? So the collection bag is this Foley here, and as you can see, this got some urine in it. Alright, so the collection bag is just that. It's just something that, you know, urine collects into, okay? And it's connected to the Foley catheter, which is in the patient, okay? Alright, so you don't want it above the patient, you don't want it way up here, okay? You always want it to be dependent, okay, which means lower than the bladder, okay? So we got this here, and we need to empty it. How do you empty it? Well, first of all, you're going to gather your supplies. And your supplies are some paper towel to put down on the floor because you don't want to make a mess, okay? So paper towel and what we call a graduated cylinder. So this is what we call a graduated cylinder. It has markings on the side where you can measure for I&O, which is intake and output, right? Okay, so there's markings on it, and that'll come important when we get done with emptying the bag, okay? So you will also need a alcohol pad and a pair of gloves, okay? All right, so you've gathered your supplies, you have performed WIPSA, and you're going to empty the Foley catheter. So you'll have put on your gloves because we're dealing with bodily fluid, okay, and we want to always wear gloves when we're doing that, right? Okay, so we have our gloves on, we have our cylinder, and we put the paper towel on the floor. I'm going to try to do this without getting in the way as much as possible. That might be hard, but I'm going to try. So we place the graduated cylinder on the floor, okay? And you're going to put it underneath the bag, okay? You're going to get your alcohol pad ready to go because you don't want to be fumbling with trying to open the alcohol pad when you have the dirty tube in your hand from emptying the catheter, okay? Let me try the other side, see if it will be better. Okay, so we have our alcohol pad ready. All right, so now what we want to do is we want to take this tube out from the bag itself, okay? So we're going to remove this tube from here, and see? It doesn't drain. Oh no. Oh, that's okay because we didn't hit the button. Okay, there's a safety device on it. Every facility is going to use a different Foley bag. You just have to get used to the Foley bags that are being used, the collection bags that are being used at your facility. This one's a push button, some of them might be a clamp, but every single one of them will have a safety or closure to it, okay, so that we stop the flow of urine, right, or we stop the germs from getting in the bag, okay? So this one's simple. This one is just push the white button, yeah, like that, and you see the urine just comes right out. Okay, so we're going to empty it. Okay, and then we're going to push this closed. We're going to take our alcohol pad and we're going to wipe the end of our hose, and then we're going to stick it back into our housing unit. And there. Why do we empty the end of the hose? Well, first of all, urine smells, okay? And after it sits there a while, ew, right? And then, you know, we just want to cut down on the germs, okay? So always wipe that off. And then you're going to pick up your graduated cylinder and you're going to look to see how much urine is in the graduated cylinder. You can't hold it like this because it's not going to get an adequate reading. So you're going to hold it like this right here, okay? How much you think is there? How much? Let me see. I see 500 milliliters of a clear yellow urine, okay? You always want to look at the color, the consistency, clear, cloudy, specks of stuff, blood, sediment, right? How much? So this is all stuff that we're going to look at, okay? Then you will clean up your supplies. So your paper towels and alcohol pad. You will dump the urine in the toilet. You will rinse the graduated cylinder. You do not just empty the urine and put the graduated cylinder back without rinsing it, okay? You would clean up all your supplies, get rid of your gloves, wash your hands, and document all your findings. And that is emptying a collection bag. Now, I'm going to try to pause this again and then come back to the same video. We'll see if I do it correctly. Okay? Here we go with a pause. Alright, I'm back. Hey, I did it correctly this time. Yay! Okay, so now we're going to learn how to remove a catheter. Well, first of all, you're going to gather your supplies. What are your supplies? You're going to need a chucks or a disposable pad. You're going to need a pair of gloves and a 10 milliliter syringe, okay? 10 milliliter syringe. Why a 10 milliliter syringe? Well, when they put the Foley catheter in, they fill a balloon in the tip of it with normal saline. They usually instill 10 milliliters of normal saline, okay? So that's why we need a 10 milliliter syringe to withdraw the fluid that's in that, okay? All right, so we're gonna gather our supplies and we're gonna perform WIPSA, okay? Then we're gonna position our clients supine and spread their legs like this for ease of removal, okay? We're going to put our chucks down underneath the peri area, okay? And then we're going to remove the leg band that attaches the Foley catheter to our patient, okay? We're going to make sure we don't pull on that catheter, okay? All right, so then we remove the leg band. They don't need that anymore. We're taking it out, right? Okay. So then what we want to do is we want to make sure that the bag is empty prior to removing the Foley catheter. Why do I say that? Because in a minute you're going to be able to take the Foley catheter and wrap it right into this disposable chucks that's underneath the patient and take the Foley catheter, the bag and everything right to the garbage and throw it all out in one fell swoop. If you forget to empty the bag, then you're sitting there holding a catheter trying to empty the bag, and you see it's just not as easy for you to empty that bag at that point. So you want to make sure that the bag is emptied prior to removing the Foley catheter, okay? All right. So then what you want to do is, this is the not airport, but fluid port. This is where you would put this is where you're going to put the 10 milliliter syringe in order to withdraw the normal saline from the balloon, okay? And I say 10 milliliters because that's normally what goes in, okay? So we're going to withdraw 10 milliliters of normal saline. This isn't as easy as it looks with this mannequin, sorry. See why I put the chucks and why I wear gloves, right? Okay, we're getting there. Let's look. We're only got about 9 milliliters, so let's try to draw off a little bit more. Alright, got 10 milliliters of saline out of there, okay? Then what I want to do is I don't want to just come and pull, because just in case there's still more fluid in that balloon, I don't want to cause trauma to the urethra. So we're going to give it a slight tug, and see, it's coming through, it's coming through. Okay, and I got it slowly. All right, so what I want to do now is I'm going to wrap this Foley catheter up inside the chucks, okay? And I could take this chucks and the Foley catheter, see, everything all in one fall swoop to the garbage, okay? So this all would go in the garbage, okay? And then what am I going to do? I am going to wash and dry the perineal area, okay? So you're going to have, oh, I forgot about the basins. So you want a soapy washcloth, a rinse washcloth, okay, and a towel. Okay, you can put the towel down underneath the perineum. You're going to have a wash. You're going to wash, okay? You learn this outside, and then you're going to go the different four corners, right? Okay. Okay, and then you're going to rinse it the same. Okay, rinse it good, and then you're going to pat it dry. Okay, and then you're going to position the patient in comfort, in a position of comfort. You're going to clean up your supplies. You're going to store your supplies. Take off your gloves, wash your hands, and document the removal. So prior to removing the Foley, what's the big thing that you need to remember to do? That's right, that's right. You don't ever want to just remove a Foley catheter without a physician's order. So you will make sure that you have a physician's order before you remove the Foley catheter, okay? All right. So after you get done documenting and all that, you're going to go back and you're going to make sure that your client is able to void on their own. You want to know the first time they voided and how much they voided over the first 8 hours. So you're going to check with them every half hour to an hour to see if they have voided. If urine retention is suspected, you may want to do a bladder scan or palpate the bladder for fullness. You're definitely going to notify the physician if the client hasn't voided within the 8 hours, okay? I usually like to go about 3 or 4, but you know, it's okay to wait. Some people don't urinate as often as other people, okay? So that is the whole skill of 6.16, performing catheter care and removal.